Diabetes, you have the type 1 and type 2, okay? You have type 1 people, they need insulin. You got to get insulin from outside. So they take IV insulin and sub-Q insulin, no matter what. The type 2, they can take something by mouth and they can do injection, but they make their own insulin. It's not enough. Okay, it's not enough. So they need some supplement to do that. The key aspect of this, what we'll be talking about, is to recognize the insulins the group of insulins that are available. There's those that are rapid acting. And I like to use the name, as like I've told you guys before. Scientists, basically, they don't know how to describe things. So they describe things based on what they look like. So rapid acting, that means I'm acting really, really quickly, very short time. Something that will happen really quickly. So like 5 to 15 minutes is acting onset. So that's his onset. And then this medication will peak within like a very short time. Within an hour, they already peak. So peak 45 minutes to 60 minutes. They already peak. And then the duration is very short, like 3 to 4 hours. So when you give them a rapid acting medication, the best time to check on them is what? An hour. That's when they will become hypoglycemia. That's the side effect. And that is what they're going to ask you in your test. This is what they're going to ask you in the test. Like you give medication to somebody, and then when is the best time to check on them? When does they become the side effect of the medication take effect? For rapid acting, it's usually the peak is 45 to 60 minutes, so an hour. The examples of them is, I call them the lag. Okay, they are the lag. Losupro, if you have another acronym, that's fine, but they're the lag. Losupro is number 1, and Aspart number 2, and Glargine. So as number 2. So these are the examples of rapid acting based on the name. Okay. And what do you use this for? Think about it. You don't have to memorize it at all. That's why I hate memorization. I'll put it here. What did you use this for? They are rapid acting. So if they're going to act right away, you got to have sugar in your system. If there's no sugar in your system, then you're going to become hypoglycemic right away. So they are the pre-meal medication. You give it to them, and then they got to eat right away so that they can have sugar in the system, and this will take care of it. So very, very important, and the best option for postprandial hypoglycemia. So if the patient eat and their sugar is high, the best way is to give them either rapid acting or the next one, which is the short acting. Okay, so good for pre-meal medication, good for postprandial. You have to give it to them. After you give it to them, they have to eat, because if there's no sugar in their system, guess what? Bad things will happen. The next one is the short acting. Okay, so they use this word rapid acting. When they say rapid acting, they mean the faster one. And then there's a short acting, which is usually regular insulin. There's nothing in that group. It's regular insulin. And this is what you use in somebody in DKA. This is the only one you use it in DKA patient. Okay, you use this one. The rest, any insulin shouldn't be used in DKA except regular insulin. And their onset is also short. Based on the name, it's short. Okay, so 30 to 60 minutes. And you expect them to peak early. If something that is short, it will shoot up and take care of the glucose and then come down. Okay, so 2 to 4 hours is already peak. And then the duration, it can last longer than short acting. So in the multiple choice, don't struggle too much. I know short acting is very fast. This is how long it can go. Regular should be in the middle. Okay, the duration it should be like 6 to 8 hours. And the only thing in that group is just regular insulin. And so the next group is intermediate, okay, intermediate group. So intermediate. And like I said, the name makes sense, right? Intermediate. And there is only one in that group, NPH. NPH. It's intermediate. What is intermediate of the day? The day is 24 hours. Intermediate is in the middle, exactly 12 hours. Therefore, if something is intermediate, it should be right in the middle. And to take for the medication to work for 24 hours, well, you give it to them twice a day. That's how you can remember, twice a day. That's the only medication you give twice a day. The rest is multiple times or once a day. This is intermediate. So due to the duration, based on its name, because it's an intermediate, it's going to pick like 2 hours. Okay, sorry, it will pick. The onset is 2 hours, and then pick 6 to 12 hours, 6 to 8 hours before it goes down. But I don't like the norms, the range. I like 6 hours, because if it's 12 hours, you take it twice a day, and it lasts. The duration is 12 hours. Then it should pick at 6 hours, half of the time. That's how I remember it. Very short, norms, focused, straightforward. Twice a day, onset 2 hours, or even norms, twice a day, because the duration is 12 hours to last you for 24 hours. Because the duration is 12 hours, I should pick in 6 hours. Onset is 2 hours. That's the only group in it. And the last group, they're very important. They are used for long-term control. So they are the long acting. So they last for a long time. Example is Glargine, which we already talk about, and determine. Okay. Sometimes they can give you another one. I don't like this medication because it's confusing. It looks like determine, but it's deglutate. They are the same derivatives. They are IV. This is once a day because it's long acting. Once a day, you take it once a day. It has no peak at all. Because it's once a day, it cannot peak. Things peak if it's going to go down quickly. So you pick, that means half of the drug is gone. Then you pick the half of the drug. These ones don't pick, and because you take it once a day. And the onset, it should be the longer onset compared to the other one. So this should be 3 hours. And the duration, you already know, it should be 24 hours. It lasts for 24 hours. And this is how you can remember all these medications. Why do I do this? The side effect of all is what? Hypoglycemia. Try to figure out what the examiner is going to ask you. If I'm lowering your sugar, then you should be worrying about side effect, which is hypoglycemia, and you follow them at their peak time when the medication has done its job, not at the end, not at the onset, but at the peak time. And when we say peak, we mean that you give the medication to them, and the medication go like that, boom. And so this is the time, this is the onset, this is when it's acting, and this is when it's finishing. Here you have 50%, here you have 50%. At this point, the medication has peaked, and this is where they're likely to get sick. So you got to see them at the peak time. What do you do if they are hypoglycemic? Well, there's certain things you can do. First, you have to recognize it. Okay, you have to recognize when they are hypoglycemic. The sugar control your body function and mostly your sympathetic system. That's the way I remember it. So sugar, okay, most of your sugar or glucose control the sympathetic nervous system. Think about it. When you see a rat, you're running away. Snake, you're running away. The sympathetic nervous system kicking. And so when sugar controls your sympathetic system and there's no sugar, sympathetic system will get mad and start acting out. So acting out, I'll call it acting out of the sympathetic nervous system. And what does your sympathetic nervous system do? Well, it will make you hyper, okay? So they have tremor, right? They sweat. You have tachycardia. That's how I remember it. This is the way you got to make things easy for yourself. They get confused. They can think fast, okay? Because the body is so hyper, you can't think, okay? You can't do anything. And then you'll be hyperventilating, you feel drowsiness. And so this is the implication. It's all pathophysiology. And when you check their finger stick, it will be less than 70. This is a B sharp moment. So you got to be sharp. Check my prioritization technique. You see it there. So that's what you see in this condition. So what do? You treat this patient. This is the key. This is your exams. You treat them based on symptoms. Okay? They can have sugars less than 70. It doesn't mean they have symptoms. If they have no symptoms, you just watch them. So you treat them based on symptoms. Check if they are unconscious. Okay, just if they are unconscious or drowsy. They cannot stay awake. Yeah, that's the key. If they cannot do that, you give them 1 gram of IM or sub-Q glucagon. Because you can't put anything in somebody's mouth who is unconscious or drowsy. That will kill them. Okay? You have to give them 1 gram of that. Or if you don't have it available and you have IV access, you give them D5, D50 IV. Okay? And then you repeat it 10 minutes later to make sure they are okay before they call your doctor. Do not choose this answer. If somebody is hypoglycemic, they ask you, what do? Don't do that. If you choose that, you're wrong. You're not taking care of the patient. There's something you can do without an order. An unconscious patient and drowsy who is hypoglycemic, you're calling a doctor, you're killing the patient. Do something. That's the time that they're asking you to be a doctor right away. You can do this without even calling the patient, doctor. So D50 IV, well, you can give it to them. If you have glucagon available, yeah, you need to be giving to them. Otherwise, the patient gets into it. Then you call the doctor, okay? If they're conscious, now I can talk to you, but I can see that your blood sugar is very low. Yeah, I have a choice, a lot of choice. They get 15 grams of glucose, quick acting, I call it, quick acting carbs. You give them 15 grams. And the technique is 15, 15, 15. So 4 15s, think about it. Hypoglycemic, conscious, you get 4 15s. You give them 15 grams of quick acting, recheck in 15 minutes. Okay. Then give them 15 grams again if they're not doing well. Then recheck again in 15 minutes. Okay. If their blood sugar is less than 70, they need another 15 grams. So that is the way to manage them, 15, 15, 15. So just be careful when they give you the choices, you know what you're talking about. The problem is, well, okay, doctor, what is 15 grams? Yeah, I have to do this conversion myself. I went and wrote it down. So you can get 4 ounces, which is the same thing as 120. I like the ounces, but I did the conversion myself. So whatever you like. Ounces and cup is my favorite. So 4 ounces or 1.5 cup, okay, of regular soft drink. So they can drink some juice or fruit juice. That will give you 15, okay? Another one is you can get an 8 ounce. If it's 8 ounce, then it should be 240 ml. Okay, if it's 240 and this is half a cup, this should be 1 cup. You see, you just have to just do the conversion. You get a low fat milk. You get to drink that milk. The other option is if they have honey available or syrup, you just get a tablespoon. That's it, 1 tablespoon, which is the same thing as 15 ml, okay, of honey syrup. And 1 tablespoon is between 2 to 3 teaspoons. So if they give you a teaspoon, it's 2 to 3 of them. They can also get 1 cup of raisins. That's also good. That will give them 15. If they have sugar tabs, they can get 3 to 4 glucose tabs. Some of them have it on their body, so they can have it. After all this is normal, sometimes you may have to give them to maintain their glucose normal. After you've done the 15-15, in order to maintain the glucose normal, you may have to give them, I'll put it here. If their blood sugar, when you get the glucose to be normal after you've done the 15-15 and now their blood sugar probably is like 70, in order to prevent them from going down again, they recommend you give them 7 grams of protein. I don't think they may bother you guys too much about it, but if you see that they say you've done this, and the sugar is still, it's like, what else can you do? Yeah, this is the last one, 7 grams of protein. And the best way is peanut butter. Okay, just give them some peanut butter. That's all. And then 2 tablespoons. And cheese is good. Cheese, 1 ounce of cheese. That will get them to. Okay, so this is why we learned this. Maybe you can see, I can put, oh, I lost it. This is why we learn it, because that's how you can connect everything together. Okay. So now we talk about the IV subcu insulin. Sometimes there's some they take it by mouth. You can group them. We're not going to waste too much time, but I just want to give you some. The common one that you should know of is metformin. Okay. What this does is it just inhibit glucose production, so prevent sugar production. Okay. That is its function. And therefore, if it's preventing sugar production, and it causes the sugar to take more insulin, so it increases insulin effect. So it potentiates the effect of the insulin. Therefore, what it means is it decreases insulin resistance. So it decreases insulin resistance. Anything that affects insulin production is very important, because then they affect your weight. Okay, this doesn't stimulate. It doesn't stimulate the insulin. It's very important. Therefore, they don't gain no weight gain. This is the clinical. I want you to pay attention. No weight gain. This patient, because it's not stimulating glucose, no insulin production. No insulin production. Therefore, it just makes the insulin work better and let the cells take the glucose out. So these people don't gain weight. The other thing I would say about this is, if you're getting contrast allergies or contrast medication, you're getting a CT scan or cardiac catheterization, anything that require contrast, the patient need to hold this for 48 hours, and then they have to wait 48 hours after the procedure before they start. Otherwise, they get lactic acidosis. You don't want that. And that's what they will ask you. This is a B-sharp moment. You interact, you intervene. Somebody is on metformin and they're getting cardiac catheterization or CT scan and you don't hold it, that's wrong. You got to hold it 48 hours to prevent metabolic lactic acidosis. So that's the one group. Okay. The other group is the sulfonylurea. So it's a sulfur drug. We've seen sulfur drug before. So you can see based on the name, I did not list all sulfur drugs, but you see it's a sulfonylurea. So therefore, all the side effects we listed is consistent with our photosensitivity, agranulocytosis, all those things we have. The example is glipizide, okay? Remember, these are medication you take by mouth. This is good for type 2 diabetes, all of them. What does it do? It stimulates insulin production. And what did I tell you? If you stimulate insulin production, you gain weight. Therefore, these people, they gain weight. Okay? They gain weight. And therefore, the risks of hypoglycemia, like any medications, diabetes medications, hypoglycemia, because they're stimulating insulin production. Remember, metformin doesn't stimulate insulin production, and therefore it does not cause too much hypoglycemia. It just let the cells take it out. If you release insulin, insulin does its job. It pushes glucose inside. And therefore, risk of hypoglycemia is higher for sulfonylurea than metformin. Sulfonylurea example is glipizide. And they gain weight also. And therefore, you should avoid it in elderly patients. So like we did the best criteria. This is one of them, anything that will cause hypoglycemia. Okay, it's a sulfur drug too. We talk about it. So sulfur drug complications you should worry about. This is how you put it together. You see our system together. One thing you should avoid is alcohol. It causes hypoglycemia. Alcohol causes hypoglycemia. And therefore, this medication is causing hypoglycemia, well, then it wasn't it. When you drink alcohol, you become hypoglycemic. And this is, you can't drink alcohol with sulfonylurea. Okay. So the next group is, yeah, I'm just giving them to you because of the side effect that they have, the Meglitinides. You see it in your textbooks, but example is because of the side effect, rapaglinide. That's example. They have the last name glinides. This to stimulate insulin. Therefore, you can see that weight gain. Therefore, you can see that weight gain. What is the why I'm mentioning this? Because of the side effect of that. So know the side effect. They also causes weight gain. Okay. And those are the ones I just want to talk about, and their side effects, so you can remember them. And if they give you those medications, you can be able to see how they function. The last one is NPH. Okay, NPH. We already seen it. Just want to say that this is the only one that you give it to sub-Q. If they give you a question, they say IV NPH. Your brain telling you, oh, it's insulin, it's okay. Please, please, please. I'll put star here. No, you can't do that. Absolutely no. No IV NPH. Okay, it's giving sub-Q. Okay, you can't do that. So NPH is only sub-Q medication for therapy. You can't do that. It's only giving a sub-Q, and then you don't give it through IV. If somebody give it through IV, we got to protest, intervene, teaching moment. Okay? So I think this is inclusive for all the diabetes. I think that's enough for that.